Hi, a very good evening, all of you. So, today's paper discussion part, 15th part, will deal with the following topics. I hope you guys are all ready. The first will deal with scleroderma. There seems to be a case based and histopathologic image related to this topic. So, as you know, systemic sclerosis, also called as scleroderma or dermatosclerosis or hidebound disease, is a systemic connective tissue disease characterized by vasomotor disturbances, fibrosis, subsequent atrophy of skin, subcutaneous tissue, muscles, including internal organs such as lungs, heart, kidneys, CNS, etc., with associated immunologic disturbances. As you can see, clockwise, starting from 10 o'clock position, you can see progressive systemic sclerosis characterized by induration of skin and fixation of epidermis with deeper subcutaneous tissues. And 12 o'clock, you can see extreme fixation of skin to the underlying connective tissue or to subjacent connective tissue. And then you can also see scleroderma on hand, bottom left. And with respect to oral cavity, you can see limited mouth opening, which is very much evident in this particular case because of involvement of perioral skin. And also the extreme right, you can see a radiograph IOPA, so extreme widening of periodontal ligament, which is obvious in case of scleroderma. Now, moving on to the next topic, levels of prevention was another question, I reckon. So, based on keywords which you received. So, there was one question on primordial prevention, and also there was another question, I suppose, on different levels of prevention. As you can see, primordial, primary, secondary, and tertiary. We discussed this in our study club discussions as well. Now, moving on to the next topic, implant ocular prosthesis. These are the keywords which we received. So there are broadly two categories of implants with respect to ocular prosthesis, which include non-integrated and integrated. And what you're finding, A, B, C, and D, these are all integrated implants. So hydroxyapatite A, and then B is bioceramic. C is COI implants, which stands for conical orbit implant or conical orbital implant, and D is MedPOR, right? So various materials used for implanting ocular prosthesis. Again, let me know what the question is in specific. I'll see if I can provide you more information relevant to your query. Okay, now moving on to the next topic. Multistage sampling is one of the keywords that you receive. As you know, sampling technique is a process or technique of selecting a sample, as you can see in the illustration, based on appropriate characteristics and adequate size. Multistage sampling divides large populations into stages to make sampling process more practical. In fact, in one of the PubMed indexed articles, clearly mentioned that multi-stage sampling entails two or more stages of random sampling based on hierarchical structure of natural clusters within the population. By clusters, they mean clusters are natural grouping of people, for example, based on various categories of parameters like schools, households, etc. A different type of cluster is randomly sampled at each stage, with the clusters nested within each other at successive stages. The final stage of sampling involves choosing a random sample of people in the cluster selected at penultimate stage. Multi-stage sampling methods can be used to recruit participants in experimental or observational studies. Some practical relevance. Moving on to the next topic. Again, let me know if you need any further clarification. Diabetic nephropathy, initial signs, these are the keywords which we receive. So this information is from Davidson. Diabetic nephropathy is among the most common causes of end-stage renal failure, ESRF, especially in developed countries. About 30% of patients with type 1 diabetes have developed diabetic nephropathy after 20 years, but the risk after this time falls to less than 1% per year. And risk factors for developing nephropathy include poor glycemic control, duration of diabetes, other microvascular complications, ethnicity, hypertension, family history. Right? And also you can see a diagnosis and screening criteria for diabetic nephropathy. Pathologically, thickening of glomerular basement membrane is followed by nodular deposits, Kimmel-Still-Wilson nodules, and as glomerulosclerosis worsens, heavy proteinuria develops. Sometimes in nephrotic stage and renal function progressively deteriorates in case of diabetic nephropathy. So I hope this information is helpful. Again, let me know if you need any further clarification. Moving on. Image-based question related to maxillary sinus lining. So these are the keywords which you received. As you can see, Schneiderian membrane, right? So pseudostratified columnar ciliated epithelium. So as you can see, let me know what the question is in specific. I'll try to provide you more information relevant to the topic or question. So mucous membrane epithelium of maxillary sinus, as you can see in this particular slide. The top one, A, it's apical region of second premolar histologic image. Lining of sinus is continuous with periapical tissues through openings in bony floor of a sinus. As you can see, it's been labeled as well. And B is high magnification of epithelium of a maxillary sinus, as we discussed. A pseudostratified columnar ciliated epithelium, right? Moving on, drugs, falciparum malaria. So these are various drugs for chloroquine resistant as well as multi-resistant Plasmodium falciparum. So see if this information is helpful in answering your query, or else you know the protocol, right? Moving on, diastema closure. So we can use removable appliances or simple fixed appliances to achieve diastema closure. So as you can see, a simple fixed appliance where we're using elastics. So there are various components as you can see. So elastics which are used here slide teeth together along arch heart segment, and also tubes prevent rotation and maintain axial inclination of incisors. Light elastics are to be preferred. Also, we can use finger springs or Hollis appliance when diastema is associated with proclination. In fact, review clearly suggests that elastomeric materials or elastomeric chains of polyurethane nature are commonly used to generate light continuous forces for various purposes, including canine retraction, rotational corrections, anterior retraction, and including diastema closure. Okay, so let me know if you need any further clarification. Moving on, odontogenic keratocyst treatment, what has to be kept in mind, what should be the main consideration. So those are some relevant keywords which we received. So first of all, as we discussed in our debate session as well, in E-classes, odontogenic keratocyst should be surgically excised. So there are various modalities: marsupialization, enucleation, primary closure, enucleation, and packing open. The most important feature of OKC is its extraordinary recurrence rate. This has been reported as being between 13 to 60% depending upon the studies or a sample size and various other factors. Now let's move on to the final topic of this video, histologic image related to periodontium. These are some of the keywords which we received. So as you can see, left illustration is a photomicrograph of periodontal ligament between alveolar bone and cementum with fibroblasts arranged perpendicular to tooth surface in alveolar crest region. A represents periodontal ligament, B is alveolar bone, C is cementum. Right? In the right illustration, you can see transverse section of periodontal ligament, that is A, showing its relation to alveolar bone, that is B, and cementum, that is C. So as you know, the periodontium is a connective tissue organ covered by epithelium that attaches teeth to bones of jaws and provides a continually adapting apparatus for support of teeth during function. It comprises of cementum, periodontal ligament, bone lining the tooth socket, that is alveolar bone, and that part of gingiva facing the tooth, that is dentogingival junction, right? So these are some of the topics which I wanted to highlight in this specific video. So let me know if you have any additional keywords or if you need any further clarification relevant to topics discussed in this video, just drop a comment. We'll update additional information in the form of clarification and description part of this video in 24 to 48 hours, right? So appreciate your enthusiasm, love and affection. So wish you all the best. Love you all. Take care.